Hello everyone and welcome back to the Victory Education Lounge, the go-to channel for all your medical residency interview prep. We're here to help you navigate the tricky waters of residency interviews. Today, we're setting our sights on one of the most commonly asked questions. What are your strengths and weaknesses? So, if you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of interview questions and move one step closer to your residency goals. While it might seem straightforward, this question is a subtle test of your self-awareness, honesty, and commitment to improvement. It's not just about rattling off a list of qualities. It's about showcasing your understanding of yourself as a professional and as a person. It's about demonstrating that you can recognize your areas of strength and use them effectively, and that you can also identify your areas of weakness and work towards improvement. So, how do you craft a winning response? In the next few minutes, we will explore 5 effective strategies. First up, the balanced approach. This strategy is all about presenting a well-rounded view of yourself, showcasing both your strengths and weaknesses in a way that paints you as a realistic, self-aware candidate. So let's dive into how you can use this approach in your residency interview. Imagine you're sitting across from the interviewer, feeling the weight of their gaze as they ask, "What are your strengths and weaknesses?" You take a moment, gather your thoughts, and then you begin with a strength that is directly relevant to your potential role. You might say something like, "One of my key strengths is my meticulous attention to detail. This trait has proven invaluable in making accurate diagnoses, a skill that I believe would be beneficial in this residency program." By starting with a strength that is directly tied to your prospective role, you're immediately positioning yourself as a strong candidate. But remember, it's not just about showcasing your strength. This question is a test of how self-aware you are and whether you're capable of recognizing areas for improvement. So, next, you'd move on to a weakness. Now, it's crucial that this weakness is genuine but not detrimental to your potential role. For instance, you might say, "However, I do tend to be overly critical of my own work. I realize this can sometimes lead to unnecessary stress, so I'm actively working on managing this trait by seeking regular feedback and implementing stress management techniques." The strength shows you're well suited for the role, and the weakness shows you're human, just like everyone else. More importantly, it shows that you're actively working on your weaknesses, highlighting your commitment to personal growth and professional development. And that's it. That's the balanced approach. A strength that makes you a strong candidate, a weakness that shows you're human and capable of growth, and a commitment to improving yourself. The key here is balance. Remember, nobody's perfect, and the interviewers don't expect you to be either. They're looking for someone who's self-aware, honest, and committed to growth. And the balanced approach lets you show them just that. Next, the storyteller. This approach is all about harnessing the power of narrative to make your strengths and weaknesses come alive. Stories are engaging, they're relatable, they stick in the mind. They're a superb way to frame your response to this classic question. Let's start with your strength. Instead of just stating it, weave it into a story. For instance, you could say, "During a challenging clinical rotation, I found that my ability to remain calm under pressure really came to the fore. We were dealing with a particularly complex case, but I was able to keep a clear head, coordinate with my team, and ultimately we were able to provide the patient with the care they needed." Do you see what we did there? We didn't just claim a strength, we illustrated it in action. This gives your interviewer a vivid, memorable snapshot of you exercising your strength in a real-world context. But what about your weakness? Here's where the story gets even more interesting. You could say, "In the past, I struggled with delegating tasks. During a group project, I took on too much and ended up feeling overwhelmed. I realized that I needed to trust my colleagues more and share the workload. So I started taking steps to improve my delegation skills. I attended a workshop, read up on effective delegation, and started practicing it in my daily work. Now I'm much better at it and continue to improve." Again, we've done more than just state a weakness. We've told a story of realization, struggle, and growth. This shows your interviewer that you're not just aware of your weaknesses, but you're actively working to overcome them. The storyteller approach can make your response to, "What are your strengths and weaknesses?" stand out. By sharing your experiences, you're not just telling your interviewer about your qualities, but showing them. Remember, stories make your answer relatable and memorable. So don't be afraid to tell your story. After all, it's the story of your journey towards becoming the best physician you can be. The third strategy is the growth mindset. This approach is all about acknowledging your weaknesses, but more importantly, demonstrating how you've tackled them head-on. It's about showing that you're not afraid of a challenge and that you're committed to continuously improving yourself and your skills. Take a moment to think about a time when you recognized a weakness in yourself. Perhaps it was a technical skill you lacked, or maybe it was a particular area of knowledge that you felt unsure about. The key here is to be honest about that weakness, but not to dwell on it. Instead, focus on the steps you've taken to overcome it. For example, you could say, I realized that I wasn't as proficient in cardiology as I wanted to be. I felt it was a weak spot in my overall medical knowledge. But instead of letting that hold me back, I decided to take action. I enrolled in additional courses, sought advice from mentors, and spent extra hours studying. I didn't just want to improve, I wanted to excel. After you've outlined your weakness and the steps you've taken to improve, it's time to highlight a strength. Ideally, this strength should be one that helped you overcome your weakness. Continuing with our example, you could say, one of my strengths is my determination. I've always been someone who sets high standards for myself and doesn't settle for good enough. It was this determination that drove me to address my weakness head-on, and I believe it's made me a stronger, more well-rounded medical professional. By approaching the question with a growth mindset, you're showing the interviewers that you're not just capable of identifying your weaknesses, you're also capable of taking the initiative to improve. You're showing them that you're resilient, committed, and driven to be the best that you can be. And remember, everyone has weaknesses. What sets you apart is not the absence of weaknesses, but your approach to overcoming them. This shows resilience and a commitment to self-improvement. Scene script. Strategy 4 is the reflective practitioner. This strategy revolves around the idea of using feedback as a tool for growth. It's all about demonstrating your ability to reflect on your actions, accept feedback, and use it as a stepping stone towards improvement. Imagine you're in a surgical rotation, and your mentor points out that your suturing technique needs improvement. Rather than getting defensive, you take this feedback on board and actively work to improve your skill. You might attend additional suturing workshops, practice diligently, and ask for further feedback until you see progress. This is a classic example of a reflective practitioner. Now let's talk about how to use this strategy in your response. Begin by openly sharing a piece of constructive feedback you've received. This could be anything from improving your communication skills to refining a clinical skill. The key is to be honest and show that you're open to learning. Remember, everyone has room for improvement, and acknowledging this shows maturity and self-awareness. Next, explain the steps you've taken to address the feedback. Maybe you read books on effective communication, or perhaps you attended extra workshops. It's important to show that you didn't just accept the feedback, but actively worked to improve. Then, transition to discussing a strength that was recognized by others. Maybe a professor commended your diagnostic skills, or perhaps your peers appreciated your leadership in a group project. The idea is to balance your weakness with a strength that others have validated. The reflective practitioner strategy is powerful because it shows that you're not just self-aware but also proactive in your growth. It demonstrates that you're not afraid of constructive criticism and are, in fact, eager to learn and improve. It shows humility, resilience, and a commitment to becoming a better healthcare professional. This approach demonstrates humility and the ability to grow from external feedback. It illustrates that you're not just a passive recipient of knowledge, but an active participant in your learning journey, always striving to be better than you were yesterday. Finally, the specialty-specific spin. This strategy is all about tailoring your strengths and weaknesses to the unique demands and requirements of the medical specialty you're applying for. By doing so, you not only demonstrate a deep understanding of the field, but also show that you've thought carefully about how your personal attributes align with it. Let's imagine you're applying for a surgical residency. You might say, one of my strengths is my steady hand, which is crucial for precise surgical procedures. I also have a strong spatial awareness, which aids me in visualizing anatomical structures during surgery. These are specific skills that directly relate to the surgical field and demonstrate your suitability for the role. In terms of weaknesses, it's important to choose something that isn't a critical skill in your chosen specialty, but is still honest and genuine. In our surgical example, you might say, I find dealing with administrative tasks challenging. However, I understand their importance and am actively working on improving my skills in this area by taking a course on healthcare administration. Here, You're acknowledging a weakness that isn't directly related to performing surgery, but is still a part of a surgeon's responsibilities. More importantly, you're showing initiative and a willingness to improve in areas you're not naturally comfortable with. Of course, the specific strengths and weaknesses you choose will depend on the specialty you're applying for. If it's a psychiatry residency, for instance, your strengths might be your ability to build rapport with patients or your deep understanding of mental health conditions. A potential weakness could be dealing with the bureaucracy involved in mental health care. Remember, the specialty-specific spin is about more than just listing your strengths and weaknesses. It's about showing that you understand the demands of the specialty and are self-aware enough to know how your personal attributes align with those demands. So, as you prepare for your interview, think about what makes your chosen specialty unique and how your strengths and weaknesses fit into that picture. Show that you're not only self-aware but also understand the demands of the specialty. There you have it, 5 strategies to answer, what are your strengths and weaknesses, in a residency interview. Let's do a quick recap. Strategy 1, the balanced approach, reminds us to present a strength and a weakness that are genuine and relevant to the field. This shows that we are not only competent but also honest about our areas for improvement. Next, we talked about the storyteller, a strategy that uses the power of narrative to highlight our strengths and weaknesses. By sharing personal stories, we make our answers more engaging and memorable. Thirdly, we discussed the growth mindset, a strategy that shows our resilience and commitment to self-improvement. By talking about a weakness we've worked on, and a strength that helped us overcome it, we demonstrate our ability to learn and grow. Then, we delved into the reflective practitioner, a strategy that emphasizes the importance of feedback in our growth journey. By sharing a weakness we've identified through feedback and a strength recognized by others, we show our humility and receptiveness to learning. Lastly, the specialty-specific spin encourages us to tailor our strengths and weaknesses to the specific demands of the specialty we're applying for. This shows our deep understanding of the field and our readiness to meet its challenges. But remember, no matter which strategy you choose, sincerity and self-awareness are key. Be honest about your weaknesses, but also show your commitment to improving them. Highlight your strengths, but remember to stay humble. Practice these strategies, and you'll be well prepared to tackle this classic question in your residency interview. Thanks for watching the Victory Education Lounge. We hope this video has been helpful in your interview preparation. Don't forget to like, subscribe and comment below to let us know what other topics you'd like us to cover. Until next time, keep striving for excellence in your medical journey.